what are the most effective strategies for channeling funding and research to the young metastatic breast cancer community? And what are the implications of those efforts, given that metastatic breast cancer is, in fact, a smaller portion of the general breast cancer community?
YSC recently did a research think tank, and we had a work group that looked at metastasis in young women, and what we found is that there just is very little to no research on this patient population. So I think there is research very much needed. But I also think we have to be strategic in what we research and what we ask to be researched, because we need to look and see what the landscape looks like, what looks promising, what doesn't, what prioritize. We can't research everything. There's just not enough funds for that. And there are organizations that have been laying this groundwork. The National Breast Cancer Coalition does a quarterly update on that. The Metastatic Breast Cancer Alliance just put out a landscape report, and YSC also has a research agenda where we prioritize research questions. So I think it's very much needed, but we need to be strategic.
Our research is around the psychosocial impact of cancer, and we tie that into the biomedical aspect of cancer. But I think we've found a lot of things that we've found evidence for a lot of things that we've been talking about on this panel. One of them is the impact on work life. So I'm heading a little bit off of the biomedical research, but we found that nearly 50% of the people in our metastatic breast cancer registry lost their jobs because of the diagnosis. Half of them involuntarily and half of them voluntarily. We look at that in terms of, we know that work is an incredible predictor of well-being and health and outcomes. And if people are losing their jobs, it will have a significant impact, not just on quality of life, but on outcomes. The other thing is that so many people have their insurance tied to their workplace. And when Rochelle was talking earlier about the good fortune of having good insurance, many of us have had the good fortune of having good insurance through our workplace. If you lose your job, what is the impact on your insurance, and therefore what is the impact on outcomes? So I think that as we're building up the biomedical research, which is critically important, we also have to understand what the impacts of living with the disease are on the outcomes, because it's not just the treatment that affects your outcome.
What is the efficacy of focusing on research of more aggressive breast cancers early on to avoid the onset of metastatic breast cancer in young women?
One of the most important things I think that young women with breast cancer can do is to participate in clinical trials. And it is, of course, the young women who are overrepresented in all of our clinical trials. And right now, we do not have early stage breast cancer trials. Right now, as you sit and listen to these meetings, we have follow-ups of 20 years on studies, but we currently do not have adjuvant trials for early stage breast cancer. There's this hiatus that we're going through right now where we're trying to sort of figure out the biology for the next stage of study designs, because all diseases are sort of defined now molecularly. So we're at a big hiatus right now, and I don't think there's anything that individuals can do per se, but this sort of importance of being on clinical trials, importance of getting repeat tumor samples, so that we can understand the individual disease in the individual patient on a better level.
We need more research. We need more young women in clinical trials and cancer registries participating.
So I do think that there is a lack of awareness and a lack of understanding about clinical trials. So one of the other things we found in the registry was that people would say that they understood what clinical trials were, but in fact, and then that you would ask, well, would you participate in a clinical trial? And they would say no, because they were afraid of getting a placebo. So clearly there was a disconnect between what they thought that they knew and what in fact was the case. So I think that we have a tremendous opportunity to educate around clinical trials and around clinical trials when women are diagnosed, because I do not believe that people care about talking about clinical trials before they have a reason to consider them.